At a quick run through the chapters of this report, the findings, conclusions, and recommendations, the committee also identified some cross-cutting guiding principles that are necessary for implementing the recommendations. These are issues that we felt really had to be better understood for effective implementation. There are three of them. The first is to better understand the phenomena involved with child abuse and neglect. It's really imperative that we move beyond what's often called social address variables like race and class to disentangle cultural processes, social stratification influences, ecological variations or environmental situational variations, and immigrant acculturation status. Secondly, this field is inherently multidisciplinary, multi-method, and multi-sector, and the methods used for research, evaluating programs have to take all those multi-approaches into account. Thirdly, we know times are tight financially, and we tried to recognize everywhere in the report that whenever possible, it's important to build from existing studies, existing databases, existing knowledge, definitions, designs, and any other opportunities so that we're really capitalizing on what already exists. I'm not going to talk through each of the recommendations, but to simply outline what they are. You've heard them linked with the specific chapters. In developing recommendations, the committee tried to identify the highest level actions, the highest leverage actions that would help us effect improvements over the next 10, 20 years in this field. So they're in three groups. The first set, there are three of them, that focus on engaging a national process to develop a strategic plan and a research agenda among all the players, private and public, that are involved with this issue, so that this current status of disparate funders, disparate work going on, different fields can become an advantage in creating a more effective research base. The second set refer to that research infrastructure and identify 4 specific steps that we thought would help improve the field as supports. The surveillance of child abuse and neglect, having a core of researchers, multidisciplinary research centers that can bring things together, just a few of those, and having a study section in NIH where a lot of this research is funded. The last area you just heard about, the evaluation of policies, had 2 recommendations. And we recognize that while we identified specific lead actors in our recommendations that you can see on the web in our report if you want to read the detail and the rationale, we recognize that there are many, many stakeholders for each of the areas of recommendations, and it's essential that all the stakeholders involved continue to be engaged for this to be effective. We just tried to identify the highest leverage actor, too, in making the recommendation. So the complete text is on the website. The slide shows where you can find it. We thank you again for giving us a chance to talk about our report, and we'll now